Welcome to the wrap of the ankle. So, using our wrap model, we're going to discuss the bones of the ankle joint first. So, on your tibia, which is the big thick bone that forms the basis of your lower leg, on the inside here, we've got something called the medial malleolus. That's that lump you can feel on the inside of your ankle. On the outside, we have the fibula, which is the long bone which sits on the outside of the tibia. This bears about 1/6 of the weight during gait. On the end of the fibula, we've got the lateral malleolus. Now in between those two, housed like a mortise and tenon joint, we have the talus. And the talus is the articulating structure that forms the talocrural joint, which is the ankle joint proper. Now underneath that, we have a joint called the subtalar joint, and that's formed by the bottom of the talus and the top of the calcaneus, the heel bone. The joints that form the ankle, so we have the talocrural, which is a joint that performs dorsiflexion, that's bringing your foot towards your knee, and plantarflexion, which is pointing your foot away from the knee. Now the talocrural is a synovial joint, and like all synovial joints, it has 5 key characteristics. It has a joint capsule, it has a synovial membrane. When the synovial membrane is stretched, it secretes synovial fluid, which is the lubricating fluid in your joints. It has ligaments, and it has hyaline or articular cartilage on the ends of the bones. Wand off means it's got 1 degree of freedom of movement, which essentially means it moves in one plane. So dorsiflexion and plantarflexion in one plane of movement means it's got 1 degree of freedom. Now you'll see underneath we've got the shapes of the bony surfaces. Now this is really important when you come to start to do mobilisations, because we use something called the convex concave rule to work out what direction we push the joint in to improve a physiological movement. The malleolus in this particular instance is concave and the tibia is convex. Underneath this subtalar joint, this is a synovial plane joint. It also has 1 degree of freedom of movement, and this is the joint that allows eversion and inversion. So turning the sole of the foot out, turning the sole of the foot in. The talus is concave, the calcaneus is convex, so that's really important when it comes to your mobilisation techniques, because that's going to allow you to push the joints in the right direction to improve the movement. We then move on to the ligaments. Now the talocrural joint, the majority of your weight bearing in your leg is directed onto the medial side of your foot, medial side of your knee. Therefore, the ligamentous structures on that side are much stronger. On the medial side of the ankle joint, we've got a collection of 5 ligaments that form the deltoid ligament. Don't get confused with the deltoid muscle of the shoulder. It's called the deltoid because of its shape. On the outside, we have 5 bands of ligaments. The 3 that you need to know about are the anterior talofibular ligaments, which sits around about here, the calcaneofibular ligaments, which sits about here, and then the posterior talofibular ligaments, which sits at the back of the joints, and that provides lateral stability. I've asterisked the anterior talofibular ligament because that's the one that is commonly injured. So when you sprain your ankle, when you go into a plantarflexed and inverted position, that's the ligament that gets stretched. The subtalar joints, this is that joint that we talked about that controls inversion, eversion. Now interosseous means between bones. Inter is between, osseous is bones. The most important ligament in your subtalar joint is the interosseous talocalcaneal joint. You've then got 2 other structures which are a little bit weaker, so don't provide too much stability. You've got the lateral talocalcaneal ligament and the anterior talocalcaneal ligament. All movements that are available at the ankle joint. So remember, the ankle joint, the subtalar joint is where inversion eversion takes place, and plantarflexion, dorsiflexion takes place at the talocrural joint. Your plantarflexors, gastrocnemius, soleus, flexor hallucis longus, so I've abbreviated the flexor, flexor digitorum longus, and then tibialis posterior. Your dorsiflexors, we must have a mirror muscle compartment. So you've got tibialis anterior, extensor hallucis longus, and extensor digitorum longus. Now the muscles responsible for inversion, we've got some crossover between the muscles that dorsiflex and plantarflex. Tibialis posterior and tibialis anterior are the inverters, the things that turn the sole of the foot in, and then the everters, turning the sole of the foot out. You've got peroneus longus and peroneus brevis.